Here's my ranking of the top 10 treatments for foot drops. So if your foot's dropping and you can't pick it up, this is the most successful stuff that I've seen, from least practical to most practical and most effective for me. Number 10, medication. How effective is medication? If you've watched my videos, you usually know I'm not a big believer in big pharma or medications. It's not effective in this case. Success rates, maybe if you're inflamed, maybe if you're irritated, maybe if it's a specific disease process or genetic process, that can help. I don't think I've ever used medication for a foot drop. I don't really know of anybody who does it, unless it's maybe like some type of nerve disease medication. Number 9, orthotic devices. So check this out. When you walk, your foot flattens. In a lot of my videos, I go over plantar fasciitis, tarsal tunnel, tibialis anterior. A lot of the times, the back of the ankle itself, as it gets sore and swollen, the nerves are irritated, they get compressed, and you don't get as much support. Just right here. When you walk, the foot flattens, collapses, the nerves stretch. You get things like tarsal tunnel, which eventually can make the foot numb. It's kind of like carpal tunnel of the wrist, but in the ankle, it's called tarsal tunnel. But watch this. In the ankle, it's not compressing. Here, it's compressing. That tarsal tunnel nerve can be related to your foot drop potentially, because it gets numb, it gets sore, your foot aches, and you learn to baby it and turn it out. I've seen this actually work way more than not. If you have a small amount of money and you want to try this right now at home, I highly recommend trying one of those out in a good pair of supportive shoes. For older people, I recommend Orthofeet shoes. They actually come with Orthotics. I have my links, discount codes below. Very worth trying for sure. There's also slippers and sandals at home. Get some support in your ankle, get your knees, get your ankles feeling better. A lot of times that can make that drop foot get better, a whole lot better, very quickly. This really depends on the diagnosis, but it does improve gait. It does help improving fall risk. It's very high success rate for tripping, and it depends on the issue. Sometimes this alone could cure it. For a stroke, for example, where the nerve is not functioning, probably won't be the single most important thing. And that's according to the Cleveland Clinic studies put out. Number 8, occupational therapy. This isn't specific to foot drop necessarily, but it improves your quality of life, but not the drop foot necessarily. So somebody comes out to your house, it's covered. They make sure you have a wheelchair ramp, for example, walkers available, handlebars in your bathroom. They can set you up with physical therapy. It can help you with your day-to-day activity. It doesn't address foot drop specifically. Number 7, home exercises. Home exercises, I'm a big believer increasing your hamstring flexibility, your calf flexibility. And again, this depends on what's actually wrong with you. If you do have strength lifting it, working on your tibialis anterior and stretching your calf muscle can work really well. I'm a big fan of the knees over toes guy, Ben Patrick, but essentially what you want to do is get up against the wall, put your butt up against the wall and lift your feet. That's working your tibialis anterior. Do that a couple times a week until you can't do it anymore. Keep strengthening your drop foot lifting muscles. Keep stretching your calf muscles. So calf stretching devices make a big difference. Strengthen your tibialis anterior, strengthen your hamstrings, and do split squats. I'm a big believer in split squats. Again, the knees over toes guy does them. I'm a big fan of these. Makes a huge improvement in strengthening those muscles. This is very practical, very easy. You can start doing this at home. 2 days a week, do 2 sets per muscle until you can't do them anymore. For the split squats, support yourself on your counter. You don't have to do it with crazy weights, just do it with your body weight. His books basically talk about strengthening and stretching at the exact same time. But what it really comes down to is 4 simple exercises. He does the split squat. So 1 foot in front, 1 foot in the back. This is a 75-year-old person doing it, but basically 1 foot in the front, 1 in the back. I usually put my hands on counters or a chair to get more help. As you lean forward, as you lean back, you can feel it stretch the front of one leg and strengthen the other leg. So you could see in the most advanced steps, it's kind of him doing that right there. That's an advanced split squat. Next, how do you strengthen your hamstrings? Basically stand, lean forward against a chair, bent over, and have your knees bent and then extend them. that works your hamstrings. Just do that until you can't do it anymore. So split squats, 2 or 3 sets, and then the hamstring extensions, 2 or 3 sets. That's it. It's that easy for your thighs and your hamstrings. I'm telling you, if you do that for a month, 2 months, you'll notice your muscles will adapt. Then after 2, 3, 4 months, your fascia, your flexibility will adapt. I'm telling you, when I started doing these exercises, I immediately started walking faster and stretching better. And then for your ankle, there's 2 exercises. There's the tibialis anterior workout. So basically, you just put your butt up against the wall and you lift your feet. And that's it. That works your tibialis anterior. The more forward your feet get away from the wall, the more you can lift your feet. It's that easy. It is such a straightforward exercise. It works so well, but it works your anterior group muscles, your tibialis anterior. And then calf stretchers. I have a link, a stretch block right here. It costs $19 to get a stretch block, or you can just put your foot up against the wall, or you could lean forward and bend your knee forward. I like the stretch block. It's pretty easy. I have one in my workout area. I do my deadlifts, everything on it. Those 4 exercises right there, you don't even need the equipment. Split squats, hamstring extensions, stretch your ankle, and work your tibialis anterior. You're going to get pretty equal. I'm telling you, they have trained thousands and thousands of people. People get faster, more flexible. That's the real underlying cause. I'm a big fan of these exercises. Obviously, there's a lot more you could be doing, but that's 4 simple, effective exercises that make you flexible and strong. Number 6, gait training. This is basically wearing good shoes, good orthotics, good braces. I'm a big fan of starting out with a walker. So use a walker at the beginning to stabilize yourself. So after you had a stroke, if you're weak, just get walking. It doesn't help you to just sit on your butt and do nothing. Use a walker, start moving, get your leg strength going, do those exercises I talked about, and your gait will get better. With effective and regular walking and training, this will help, but again, depends on the cause. At the beginning, this can be helped with rehab or physical therapy. Number 5, nerve stimulation. This could be number 1 depending on the cause, but if your signal is not actually making it down to the foot, in my braces video, and I have that link down below, I go over the best devices and how to get it. This can be 60 to 80% improvement. And I've had patients after a stroke where they have 0 nerve function down to their foot, and they wear a stimulator on the front of their ankle, and it just picks them up. So it knows to fire at the right time. These are advanced devices now, but it's non-invasive. It's an electrical pad that basically zaps your muscle to function, keeps that muscle strong, and keeps you walking. There's also braces that can do this, but again, very effective. Number 4, functional electrical stimulation. I should bundle 4 and 5 together. It's highly effective, particularly in stroke patients, 60 to 80% improvement in foot lifting. This does require a prescription. The Journal of Neuroengineering and Rehabilitation and the Flint Rehab Center published studies on this, very effective for a lot of people. Number 3, surgery. There's basically foot surgeries where you could reroute muscles to hold the foot up. You could have a different nerve and reroute that muscle to the top of the foot. In my opinion, I've done these surgeries in the past myself. It's a bigger healing time. It can be effective. It can show good results. Personally, I think the electrical stimulation devices are better. But number 2, where surgery can come in, I think when a lot of people talk about foot drop surgery, if you have a spinal tumor, if you have spinal stenosis, if you have some type of nerve compression, you can decompress that muscle. When I think about surgery, that's the kind of practical surgeries I talk about. I actually trained my fellowship decompression surgeries in the common peroneal nerve. I've seen them be effective. But again, I think there's easier solutions, especially if you're looking for home solutions. Number 2, physical therapy. This kind of goes over the home exercise, stretching, and evaluation. But what this should say is a biomechanical exam with your podiatrist or your physical therapist and somebody to reinforce you. But this is very high results. If you can lift your foot at all, that means something's compressed, something's weak, something's swollen, something's tight. Working with a biomechanical specialist or a podiatrist or a chiropractor or an orthopedic specialist, you can get that better in the vast majority of the cases. This is very practical, very successful. This is where good shoes, good orthotics, good stretching, good flexibility, all that stuff comes in. and the results are unbelievable. And number one, braces and splints. This is immediate, it's functional, it works extremely well. So I'm gonna put orthotics, good shoes, good braces all in here together because some of these braces do require good shoes, good orthotic. It stops the foot from dragging. You can do it immediately, but here's the real benefit. The brace is not like a crutch. By wearing this brace, you can actually start walking and it gets pressure off the sore areas and your nerves can kind of cool down and regain their strength and start functioning normally. So that's really what's going to happen with the brace in 90% of cases or more. It's highly practical, it's easy to use, and it's immediately effective, and it can have long-term results because it lets you be active, it lets you move more. The only cases it won't work is if it's a genetic or brain injury, like a stroke, for example. You may need something more, but even then I would still do these things because it's still the best solution and it still gives you a chance because most stroke cases do get better over time doing these things because your nerves do and your brain has an amazing resilience. God built us with an amazing ability to recover. And our bodies are amazing devices. And our bodies can be amazing. It's not always, and I'm humble when it comes to that. You know, I wish I could help everybody, but that's not the case. The majority, I would say probably 75, 80% of people, even with these longer term issues, they do get better. Check out my video, the top 10 specific braces, the cost, the reviews, and exactly how to get them. Check that out right here.